With Texas having the highest uninsured rate in the country, there are questions if Texans are able to get help without health insurance. We've got Ann Dunkelberg with the Center for Public Policy Priorities to talk about this. Good morning, Ann. How are you?
I'm well. Thank you for having me.
Absolutely. Let's get right to it. What steps need to be taken to make sure all Texans get the testing they need and the treatment during this current pandemic?
Well, we want to first say the state government has done a lot of smart things already to help build the systems that we need. And we all know that one of the issues with testing has just been having enough tests. So we're coming at this from the other side of what are some of the gaps that are left. And obviously, if you have 5 million Texans who are uninsured, then you're at risk of having people who need to get testing, who need to get treatment, actually having an economic reason to stay away from the testing and the treatment that they need. So we want to make sure that we can fill those gaps so that we have the best public health response as possible. One of the things that we've been emphasizing is that a couple of weeks ago, one of the laws that Congress passed, one of the first relief bills, created a special fund that is 100% federally funded, and that includes the cost of setting it up and running it, that ensures that you can provide free testing to almost all of your uninsured, nearly all of your uninsured. And obviously with 5 million, that's a pretty important number.
Yeah, that's a sigh of relief for a lot of people. And finally, the other question is about nutritional programs that a lot of people in this state depend on.
Yes, we have, 4 million people on Medicaid, nearly as many people getting SNAP, plus all of the school meals that kids rely on. And one of the things that we're really focusing on right now is there's a special add-on that the state could do that would be adding additional relief money to the cards for SNAP, or what a lot of us still think of as food stamps, for any family that has school-age kids, so that it would be trying to make up for the fact that they're not getting those school meals right now. And that could be really, really helpful. It takes some of the pressure off the school districts too, that have been trying so hard to replace those meals.
Yeah, every school district here has been trying very hard. And then finally, your organization believes we need to think long-term. Why is that?
Well, obviously there's no economic benefit to Texas for having 5 million uninsured. So, we would like to see a couple of major things. Obviously, Texas is one of only 14 states that doesn't provide Medicaid to most adults. So we have 3 million kids on Medicaid and less than 150,000 adults qualify. So we have a bunch of working adults that don't qualify for Medicaid, and they can't get care from the ACA insurance marketplace. Another thing that's happening that really is something that only the president can do is of those 5 million uninsured, some of those are folks who, because there's no longer a mandate, decided not to sign up for coverage this year. And he's the only one who can say, sorry you made that decision. We're going to open the marketplace back up so that you can sign up for coverage. Otherwise, people have to wait till 2021 to get insured.
Yeah, where can our viewers find more information, given that there's a lot to take in with this subject?
Yeah, I've only hit a couple of items. You can read on our blog a lot of details. You can go to C like cat, and then P, 3 Ps like Peter.org, Center for Public Policy Priorities.org. And you can read a lot more details on both the hunger and the healthcare parts.
All right, thank you, Ann. We appreciate your time. Be well.
Thanks again. You too.